Hi guys, welcome to our second class on medical coding. Today we are gonna see what is a typical overview of a patient-physician visit. So before we come to know the exact process of this medical coding, we need to know how this encounter takes place. Just as in our country, we have doctors, so we go and see the doctors for any health-related problem. And we see them by our friends, a referral, or maybe some of our relatives would have told us to visit this doctor as he is good enough in handling patients. Same way, there people in the Western countries also visit a doctor. He goes to a doctor's office. So normally we call that as a physician office or a doctor office. Here we would say as a clinic and a hospital. But the terms there that is commonly used is a physician office, and hope you remember that the place of service we were talking about was POS 11, which is designated as a physician's office. So now a patient has a health problem, he goes and visits a doctor. Before that, it's not that just in our country, where we see if a patient has an ailment, he goes and sees a doctor immediately in the evening or morning session. But that's not the case there, because they'll have to schedule an appointment earlier. So this is called appointment scheduling. Because prior to an office visit or a doctor's visit, patients have to fulfill certain obligations. Okay, so the first thing would be an appointment scheduling. This can be done via a patient portal or via Google, or they can make phone calls and they can confirm with the receptionist in the doctor's office that I want to make a visit, or I want to see your doctor at this particular time. So the first thing is appointment scheduling. Okay. Next thing is, once a patient has scheduled an appointment, say for coming Monday or coming Tuesday, the next process that takes place is demographics verification. Meaning, so what is a word meaning of demography, right? Demography is a Greek word, so which means demo meaning people, graphy meaning a picture. So it is a picture of the people, meaning the characterization of the individual. So his name, his occupation, his gender, his race, his social security number information, whether he's married or not, his social status, all these needs to be informed to the physician office. So this is called obtaining the demographic information. So first thing would be appointment scheduling. Second thing is obtaining or getting the demographic information of the patient. Okay. So before we go into the exact process here, what is a typical outflow, we need to know the type of patients. There is something called type of patient based on the presence of insurance or not. Meaning, I don't mean he's a heart patient or a diabetic patient or he's a renal failure patient. Here we say like whether the patient has insurance or whether he doesn't have an insurance. If he does not have an insurance, then this patient will have to bear the cost of all his medical expenses. Okay, so he is called as self-pay patient. So you must understand what is a self-pay, meaning this patient has the obligation to pay for all his medical expenses out of his pocket. He does not have any insurance, because the cost of medical care is very expensive. So it is inevitable that patients have to have insurance. So there are two types of patients, as we know. One is self-pay and then it is a insurance patient. Insurance patient, now it is a doctor's responsibility to collect the amount or the expenses that is being incurred on this particular patient from the patient's insurance. So in that process of acquiring or getting the medical reimbursement for the patient's expenses, this is what we call as the revenue cycle management. The process that are all encompassed within this particular workflow is we call as a revenue cycle management, where medical coding is an inseparable and a significant part of the system. You should also understand medical coding appears to be a trivial part in it because there are so many processes prior to coding and after coding. Next is the patient registration. After acquiring the demographic information of the patient, now the patients will have to register. It is otherwise called as a patient information sheet, where he will have to give all his insurance related information, his name or his spouse name or his, which is a primary insurance that he has or which is a secondary insurance that he has. So all these he has to fill in so that the staff on the doctor's side will enter into the practice management system. Because every practice will have to maintain a kind of a software to manage his patient volume, right? So we call that as a practice management system, and this can be an EMR or an EHR. So we would elaborate on all of this later. An EMR is an electronic medical record, whereas an EHR is an electronic health record. We will dwell about all of these in detail in our subsequent classes. So the staff or the receptionist will have to enter all this information in the practice management system after obtaining the patient information sheet. The fourth thing is there is something called as an encounter form or a fee ticket or a super bill. In that form, what happens is, take for instance, the physician is a pediatrician, where he will have a kind of a fee ticket or a cheat sheet which contains the entire list of the procedures that he commonly perform or the vaccines that he commonly administer to children. So this will have the entire list of the services. Sometimes even doctors will also include the diagnosis, the most common diagnosis that he encounters in the children population. So all these will be captured or all these will be printed in a form which is called as a fee ticket or a super bill. They will have to generate this encounter form after the patient registration form is completed. The fifth step is a medical visit or the clinical visit. Now this is exactly the process where the patient and the physician comes in direct communication or contact with each other. Okay, it is at this time where the patient will start narrating his ailments and the physician will examine it, or he listens to a story of the patient. He might take a history of the patient, what happened in the past, what is his social history, all information will be taken pertinent to his patient complaints. He might do an examination of the patient by way of inspection, palpation, percussion or auscultation. He might examine it. He might later on develop a plan of care by ordering certain investigations or lab tests or pathology tests. And then he might give some health advice to the patient, right? So this is a typical encounter that takes place between a doctor and a physician in the fifth process, namely the clinical visit, or for which he is exactly seeking the treatment. After this medical visit is over, what happens is patient will leave the physician. In the sense like the doctor might advise or counsel the patient to visit on this particular day, maybe a month or so or a week or so, and the patient leaves the physician's room. After that, the next process we call that as checkout, where the receptionist, he just checks with the patient and she schedules a next appointment for the patient based on the interaction the patient had with the physician. After this process is all over, there is something called as a charge entry. What happens is, as a physician maintained a fee ticket or a super bill, he would encircle the services that were done or the diagnosis conditions that warranted the performance of such treatment, and he would relay all this information to the staff. Now the staff will have to do a process called as charge entry, meaning what were the services that the physician did. Did he administer a vaccine, or did he give any kind of injection, or did he do some repair procedure since the patient presented with a minor injury? So based on that, now the charge entry staff will develop a kind of a protocol where he or she enters the charges or the services that the physician performed and the appropriate dollar amount for all of these services. The seventh process is claim generation. Once charge entry is over, now the staff or the medical biller or the medical coder will have to generate a claim. Okay, a claim meaning that now what is a claim? A doctor is seeking a reimbursement for the health service that he rendered to his patient, to the patient's insurance. So this we call that as a claim. Okay, Whereas in a medical coding parlance, you would say is a chart. The medical coder would typically say is a chart because what concerns him mostly is a medical record or the documentation side of it. Otherwise, when you club the medical record with the patient's information, registration and the subsequent accounts receivable, medical billing departments, we would call that as a claim. Once a claim is generated, the physician staff would now have to submit this particular claim to the insurance company. Prior to the submission of this claim, the staff will have to ensure that the claim is a clean claim, that there is no error in the claim submission process. Imagine the patient has given a wrong information because he has something called as a card. Every patient will have an insurance card provided if he has an insurance, right? So the patient's information in the card should tally with that of the practice management system. Otherwise, what happens is when the provider's office is submitting the claim to the insurance, there's a high possibility of this claim to get denied or rejected in the first place because of errors in the claim. So it is highly mandatory or it is highly expected that the physician office submit a clean claim as much as possible in order to seek a steady and a quick reimbursement for the services that are being done. And one thing we need to know, this claim submission should be done in a timely fashion, meaning some insurance companies might expect you to submit the claims within 30 days or some might expect within 60 days. But if you fail to submit the claims within the stipulated date, the insurance company can very well deny your claim stating a timely filing limit has expired. In that case, it is a doctor's fault and he cannot seek compensation from the patient because it was his mistake of not submitting the claims on a timely basis. Here comes a question. Now tell me, where is this medical coding involved here? Because we were seeing the typical office workflow here. Where is this medical coding as a process involved here? You should understand that there was a stage where the patient visited the doctor and the physician, after seeing the doctor, he comes out, he checks out, and the information of the services that were rendered were relayed to the charge entry staff. It is at this period, the crucial period, the physician will have to provide the medical record or the documentation part of all the services, and a medical coder who is involved there will have to arrive at the right code sets, or he will have to verify if these codes which the provider has picked up is justifiable with the extent of documentation along with medical necessity. I hope this clarifies the office workflow. Let me summarize. We'll just walk you through the entire stage again once again. The first process would be, if you want to see a doctor, the first thing would be an appointment scheduling. Secondly, it is the demographic information obtaining. Thirdly, it is patient registration. And fourth, it is encounter forms. Fifth, it is a medical visit. Sixth is charge entry. Seventh is claim generation. And then it is the last process, claim submission. With this, we have come to the end of our second session on medical coding. Please make a note of all of these stages that we have mentioned here. This will be very useful. Please put out notebook. It is highly recommended that you maintain a notebook for all the information that we are transpiring via this YouTube. Hope this session would have given you a fair idea of how a physician-patient encounter takes place in Western countries and of course in our own country. We will see in our next classes. We will start from the basics of medical subjects from our next class onwards. Also, I would like to mention that there is also a Tamil version of the entire videos that we are going to have, so that people who find difficulty in comprehending this English session can very well go and look into this Tamil version of it. As usual, please subscribe, share and spread this all to your friends so that it will be useful to them. Thank you.